All right, we're going to go ahead and get started. I'd like to welcome everyone to our third and final session of the West University first annual, actually, in the history of West, as we revamped our parent and staff academies. We're thrilled all of you are here tonight, and I know you're super busy, and we're just grateful that you're taking the time to look for another way to help your students have a safe and successful school year. I'm going to turn it over to Carlos Sikora, our Director of Special Programs, who's going to introduce our speaker session, or session speaker, excuse me.
Hi, I'm Carlos Sikora. I'm the Director of Special Education and Special Programs. And with me tonight is Dr. Susan Pantel. She was our school psychologist for the last number of years, and she continues to contract with us, retired and then came back for just a short period of time each week. So we're happy for that. And with her is Tabitha O'Neill. Tabitha is our LSSP intern that is working under Dr. Pantel. So thank you, Tabitha, for joining us as well. Dr. Pantel, I'm going to let you go ahead and introduce your topic, and thank you again for getting this together for us.
So we need to go ahead and get our PowerPoint up. Just a second. Okay, now go to first slideshow. In the beginning. Yeah, there we go. Okay, can everybody see the PowerPoint now? You can't hear me, I don't think.
I think I unmuted you.
No, we can. We can see.
Okay, okay.
And
All
we
right.
can hear you. You're good.
Okay, good. Okay.
Go, Susan.
So, start with kind of some statistics on what's going on right now. Statistics from the National Alliance on Mental Health show that 1 in every 5 children and teens either has or will develop a serious mental illness. Now, it's hard to keep track of how that's changing right now because it is changing so fast with COVID. We have a lot of statistics indicating that mental health problems have increased significantly during the pandemic. But like I say, it's hard to keep up. It's hard for the researchers to keep up with what's going on because of how rapidly the whole situation is changing. But the U.S. Centers for Disease Control and Prevention report that there's been a significant increase in demand for mental health services for children and teens during the pandemic. And also the private insurance companies are reporting that mental health claims for children and teens have risen significantly. The Kaiser Family Foundation did a survey and found that more than 1 in 4 high school students reported worsened emotional health. This survey was in the early months of the pandemic. They did another more recent survey, and only 1/3 of high school students said they felt able to cope adequately with the stressors in their lives. So 2/3 are saying they are not coping adequately right now. The American Academy of Pediatrics reports that suicidal ideation and attempts have increased significantly, mostly among girls. Haven't seen quite the increase among boys that we have seen among girls. The National 4-H Council issued a survey recently, and they asked teens about their perceptions and experiences around the COVID pandemic. And 7 out of 10 teenagers reported that they are struggling with mental health issues. 55% say they've experienced anxiety, 45% say excessive stress, 43% depression, and 61% of teens said that COVID-19 has increased their feelings of loneliness. Teens report spending 75% of their waking hours on screens during the pandemic. They were already spending a huge amount of time on screens before the pandemic, but there has been an increase in screen time for kids during the pandemic. And this is a problem because most experts in the field attribute much of the decline in mental health over the last 20 years in children and teens to excessive screen time. So it's bad news that kids are having even more screen time during the pandemic. Interestingly, 82% of the kids in this survey said they would like, or indicated that they would like for people in this country to talk more openly and honestly about mental health issues. And this has been my experience working as a school psychologist, that there are many, many teens that are struggling with mental health issues, but are trying to hide it because they don't feel that it would be accepted, or they don't feel there's an accepted venue to talk about it. It seems like there's so many teens trying to hide their mental health problems from one another, and they're not talking to each other about the problems. Now, according to the American Academy of Pediatrics, these crises have strained an already challenged behavioral health infrastructure and underscore the severity of the behavioral health crisis that is unfolding. We had a crisis going on even before the pandemic started, because there simply aren't enough psychiatrists, psychologists, and licensed professional counselors to care for the mental health needs of the country's children. It was really to a crisis point even before the pandemic. But since the pandemic, it's become much worse because there's been more demand, and then some people have not been practicing during the pandemic, and so there's less availability and more demand. And in some places, kids are waiting days in emergency rooms or departments, even weeks, for a psychiatric bed. Natalie Fondowie, a public health expert in Los Angeles, said before the pandemic, there were waits of 4 to 6 months to see an expert. Now, sometimes it's indefinite. Last year, when I was working at West ISD, I was working with families who were trying to get help for their kids, and it was very, very difficult for parents to find a counselor, an outside counselor who was available and could take their child. And some psychiatrists are asking for recommendations before they'll see a child. So the situation has gotten pretty difficult. The American Academy of Child and Adolescent Psychiatry says we need 4 times as many psychologists and psychiatrists as we currently have. And also they tend to, the ones that exist tend to be in the big cities, and more than 2/3 of US counties don't have even one child psychiatrist. So like I said, the crisis didn't begin with the pandemic. Rates of mental health problems in children and adolescents were rising sharply even before the pandemic for about the last 20 years. From 2004 to 2019, the rates of adolescent depression nearly doubled, and the suicide rate for children and teens also rose dramatically. And already in 2012, the American Academy of Child and Adolescent Psychiatry estimated that only 1 in 5 children with mental, emotional, or behavioral disorders were getting the care that they needed. And of course, resources have only become scarcer since that time. This is before the pandemic as well. These data that say that it takes an average of 8 to 10 years between the onset of symptoms and treatment in children and adolescents. So most children who are in need of mental health treatment are going without it at least 4 years before they are receiving any help. Telehealth has sort of arisen during the pandemic, and that's helped some, but it has definitely not offset the decreases in availability of services overall. So there is good news. Governor Abbott announced in July that the state will be receiving more than $210 million in emergency federal grants for mental health and substance use disorder services in response to the pandemic. And the state is planning to use that money to develop and implement more than 24 mental health and substance use initiatives, and to expand access to services, including both the virtual and in-person therapies. So why the big decline in mental health and increase in mental health issues during the pandemic? Well, the pandemic has removed some of the safety nets and protective factors that normally prevent the onset of serious mental illness. And it's introduced some other factors that put kids at risk for negative mental health outcomes. So some of the main factors that have been identified as contributing to mental health problems during the pandemic, one is the constant change, unpredictability, and loss of control. And I think we've all experienced that to some degree. Even when everybody began to feel like, okay, we're on the downhill side of this, the pandemic's almost over, then Delta came back, and I think everybody kind of feels like, what's going to happen next? There's worries about the health of self and family, and the school closure and sudden separation from friends that happened at the beginning of the pandemic. The isolation and the loss of social outlets was very, very hard on kids. And that is looming as a possibility as long as COVID is still out of control. That looms as a possibility for kids. Will that happen again? Stressed out parents is another factor in the mental health issues that children are having. Parental stress and poor mental health due to the pandemic can negatively affect children's physical and mental health, and increase the risk of child abuse and neglect even. A Kaiser Family Foundation analysis said that there have been increased mental health challenges in adults during the pandemic, and especially mothers who have kids in the home. They've been hit the hardest. And almost half of the mothers who were reporting negative mental health outcomes due to the pandemic were not able to get the mental health care that they needed. So there's a lot of stressed out parents out there who are not able to get care, and that is affecting kids. Another issue is economic problems in the home. Surveys have shown that households with children have had a lot more economic hardships during the pandemic compared to households without children. More than half of the households with children have lost income during the pandemic between March of 2020 and 2021. And millions of people have lost employer health benefits at a time when health is such a huge issue. There's other factors. There has been stress associated with remote learning for parents and children, and it's been stressful for everybody. Parents have had to learn how to be teachers. Schools have had to jump in there without any forewarning and just make things happen. Parents quarantining has been hard on young children especially. Sometimes if a parent has to quarantine, that may be the longest separation that the child has ever had from that parent. And then the school disruption that we had earlier has led to some academic gaps, which is especially an issue for kids who are already maybe on the edge or struggling in some way. Again, the increased internet and social media use and use of screen time in general. Already it was unhealthy, the extent to which kids were using screen time, and that has only increased during the pandemic. Along with that has been decreased physical activity and altered sleep patterns. And more research is showing, particularly sleep, how related sleep is, and good healthy sleep patterns to good mental health. Sleep disturbances can both cause mental health problems and be caused by mental health problems. So it can cause kind of a vicious cycle. If a child is staying up all night on their screen and not sleeping well at night, over time that can contribute to things like anxiety and depression. Then anxiety and depression in turn cause sleep disturbances, which can lead to kind of a snowballing effect or a vicious cycle. So it's really important during this time that kids are getting good sleep. And one of the main things interfering with kids' sleep is a lot of kids are on their phones off and on all night, and they have very poor sleep hygiene. Other issues that contribute to the problems are fewer health and mental health services and screening due to school closure and delayed pediatric care. So there have been breaks in care for those who already had psychological problems, and then delays in initiating care for kids who are just now developing disorders. 43,000 American children have lost a parent to COVID. So loss and grief have been issues among a significant number of children. And the risk of traumatic grief or complicated grief is greater with COVID than most situations, because the normal rituals of visiting in the hospital and saying goodbye and those kind of things are often not allowed in the hospitals during the pandemic. So pretty much everybody agrees, experts agree, that in-person school is best for children if we can possibly swing it, unless schools just have to shut down. That it is best for kids to be in school if they can, and everybody's trying to keep kids in school. But that being said, the transition back to school, once kids went to remote learning last year, was very difficult for many children. So once kids got used to being at home, the transition back was very hard on a lot of kids, and was seen in the form of separation anxiety in a lot of young children and social anxiety in a lot of older kids. So we definitely saw that at West ISD, an increase in social anxiety, particularly among older kids coming back after the remote learning period. So what are some signs that a child may need additional support? Well, in infants, toddlers, and very young children, you're likely to see regression in development. So the child may start bedwetting again, sucking their thumb again, baby talk, just behaving in ways that are developmentally young for their age. You're likely to see increased irritability, startling, crying more easily, the child being more difficult to console. Sleep disturbances, which take the form of waking up more during the night, maybe coming, into the parent's bedroom. Feeding issues, being picky eaters, refusing to eat, or complaining of tummy ache. In older children, signs that they're struggling may include changes in mood that are not usual for the child, such as ongoing irritability or feelings of hopelessness or rage, frequent conflicts with friends and family, physical complaints such as headaches and stomach aches, changes in behavior such as withdrawal from personal relationships, a loss of interest in activities that the child previously enjoyed, a hard time falling asleep or staying asleep or starting to sleep all the time, changes in appetite, weight, or eating patterns, so losing or gaining weight, not wanting to eat at all or wanting to eat all the time, and problems with memory, thinking, or concentration. With your older children, a lot of behaviors that look like just bad behavior, being irritable, talking back, slamming doors, those kind of things. If they're not typical of a child and they arise, suddenly, they're likely to represent some sort of mental health issue. So, negative behavior that's not typical for a child is very common in kids who are depressed or who are struggling with anxiety. Irritability is very common in children who are anxious. They may not show the anxiety, but they may show the irritability. And so you may feel like they're just misbehaving, whereas they're really struggling with anxiety. You may see less interest in schoolwork and a drop in academic effort, changes in appearance, such as not taking care of their hygiene, and an increase in risky or reckless behaviors, such as using drugs or alcohol. And then the worst and most severe symptom is thoughts about death or suicide or talking about it. And that may be indirect. It may not be a direct threat, but it may just be questions such as how many of these pills would somebody have to take to kill themselves, some kind of indirect threat, or if I die, I want so-and-so to have all of my things. Just talk of death in general that is not typical of that child. Suicide warning signs can be just severe symptoms of the type we already discussed. So the severe eating and sleeping problems, the more severe irritability, all of those can be warning signs for suicide. And some additional warning signs for suicidal behavior include the child feeling hopeless, helpless, feeling like a burden on their parents or their family, feeling constantly guilty, feeling trapped or stuck. Children often don't realize, or children and teens often don't realize that mental illness is an illness, and like most illnesses, it has a beginning and an end. It's not forever. And so when they feel depressed, they often feel stuck or trapped, like this, they're going to feel like this forever, and there's no point in going on with life. And so they need to be told and to understand that this will pass. Extreme changes in personality or behavior, changes in mood or energy level, including sudden and unexpected improvement. And children who are depressed, or adolescents who are depressed, they may have a very, what we call psychomotor retardation, which is be very slowed down. They're sleeping a lot. They don't talk much. When they do talk, they speak very slowly. They seem kind of groggy and low energy. Or they may have a very agitated kind of depression with pacing and hand wringing and rocking back and forth and that sort of thing. The agitated depression is a much more high risk for suicide, which doesn't mean that with the psychomotor retardation there is no risk, but that agitation adds an extra level of risk for suicide. And so when the child's energy level increases, sometimes it looks like that's a good thing. Oh boy, they're coming out of their depression. They've been sleeping for days, but that may represent some agitation occurring with the depression, which can actually increase the risk of suicide. Other warning signs are talking or writing about death in general, or becoming preoccupied with themes of death in art or music, neglecting their responsibilities, their appearance, and like I said, restlessness, agitation, pacing. Those are, you really need to see a physician or a specialist when the child is having mental health issues and it shows that kind of physical agitation. So what can parents do to reduce emotional distress during the pandemic? Well, research shows that family support has an even greater impact during times of stress like this pandemic than under normal circumstances. So showing interest in the child, encouraging them to talk about thoughts and feelings and having fun with them can have an even greater impact now than before the pandemic. Parents need to check in with their child often and watch and listen for signs that they're struggling. Reassure them that their negative feelings are normal, that it's okay to struggle, that other people are struggling, that this will pass, that they're not stuck like this and it's not going to last forever. You want to invite your child to talk about how they are feeling, but also know that it's not always easy for children to talk about their feelings. Teens and older kids may be embarrassed or ashamed of their feelings and have difficulty opening up. Younger children may not know how to talk about their feelings. And a lot of times they'll do better with play or art, kind of telling you their feelings. If you'll start with play or art, it may get them talking. So you could ask them maybe to draw or color a picture of what the pandemic has meant for them, and then tell you about the picture. And as they're telling you about the picture, they're able to open up and talk in ways that they probably wouldn't be able to do if you just said, tell me how the pandemic has affected you. Adults need to help kids understand the situation in a way that's age appropriate, not whitewash it, but emphasize the positive, emphasize that steps are being taken to address the pandemic and that better days are ahead. For the young children, you want to keep you give them factual information, but keep it simple, don't overwhelm them. And emphasize that adults are there to help them stay healthy and to take care of them if they get sick, and give them things that they can do to stay healthy, such as washing their hands. Emphasize where they have control. For older kids, you need to provide more in-depth factual information and especially dispel rumors and inaccurate information. Older kids need to be told that there's a lot of misinformation on social media, and that not everything they see on the internet is true, and they need to be given sources for accurate information, such as the CDC website. Parents and adults who work with kids need to be aware of their own stress level and how they are managing and expressing it, because children are going to take their cues from adults on how to respond. And so adults are going to need to take care of themselves so that they can better take care of the kids. And encourage kids to stay involved through Zoom or FaceTime if activities get shut down again. Main thing we need to do, one major thing is give the children a sense of control, what they can do. What can you control about this? And the thing that they can control is their health. And they can use this opportunity to learn how to be healthier, to eat better, to get enough sleep, to exercise regularly. And this is where they have control. You can help the children understand that their immune system protects them from diseases, and that their immune system is going to work a lot better if they're sleeping well and exercising and eating well. And you can kind of start some maybe family initiatives, some family health initiatives. In general, if kids are cut off from their old routines, you're going to need to develop new routines. Kids really need routines. They need rituals, they need structure, they need routines. They don't need to just be drifting through their day on social media. And so new activities such as game night or movie night, if their other activities get cut off, or build activities around health, as I said, going on walks, exercising together, doing some kind of exercise routine, or maybe learning something like deep breathing or yoga. You could do that, programs on the internet together, make that a new family ritual, and at the same time something good for their health. Help children prepare for changes and transitions to the extent possible, and let them see what's going on in the news, but take breaks from the news, because the news can be just very depressing, and just watching it all the time can be very stressful. I talked about deep breathing, muscle relaxation, brainstorming problems that arise with them, solutions, and help them identify where they have control, and identify and encourage projects that might help other people. Altruism is a great defense mechanism that helps reduce anxiety. If your child needs additional support, talk to your physician first. Remember that your child you're going to have a hard time getting a counselor right now, and so, or a psychiatrist, and you're probably going to have to start with the child's primary care provider. If they've been evaluated and diagnosed with a mental health condition, they may need 504 in the school setting, an accommodations plan. So you may need to talk to the school counselor about that. If it's really affecting their academic progress, they may need a special education evaluation. You're going to have to be persistent if the child needs counseling, knowing that the system is overwhelmed. It may take a great deal of time to be seen, but keep on persisting and trying. As far as suicide, take any talk of suicide seriously. Be sure and remove weapons, ammunition, medications. And the most important thing about suicide is to be able to talk very directly with your child about it, to not hem and haw around it or act like you're nervous, but just to ask them outright, are you having thoughts of harming or killing yourself? And find out if they have intent and a plan. Do they intend to do it? Do they have a plan? If they do, that's an emergency, and the child always has to be taken to a hospital emergency or a psychiatric hospital for evaluation if they say they intend to or plan to kill themselves. If they don't have a plan, but they're just having thoughts, then you can take them to their primary care physician and work on getting a counselor for them. And encourage them to talk to you, but give them alternative sources of support, such as the National Suicide Prevention Lifeline, and there's now a crisis text line because a lot of kids feel more comfortable texting. So there are additional resources here. For kids who are really having a crisis, they need to be taken to Providence or Baylor Scott and White, Hillcrest Hospital, or Cedar Crest Hospital is the closest psychiatric hospital. Sorry. For counseling resources, there's Starry Counseling, which has free counseling available to kids up to 17 years. And then there's MHMR, Clara Center for Families for kids with more severe emotional problems. And then there are here a lot of other resources, just the crisis text line, the National Suicide Prevention Lifeline, and some different websites where you can get more information on mental health and coping during the pandemic. So that's what I have. If anybody needs help with a particular child, I'm not there full-time anymore, but we have Tabitha O'Neill. She's the school psychology intern, and she can be contacted at this email address. And then we also have, for the general ed kids, Jimmy Gramella. He's the West ISD crisis counselor, so they can be contacted to help with any individual students. Okay, any questions or?
Dr. Pantel, I don't see anything in the chats, and if anyone has a question, feel free to jump off of mute, and we'll let our experts answer. All right, hearing none, Dr. Pantel, thank you so much for sharing the information tonight that you did with our team and our guests, and we'll make sure that this is posted to our YouTube channel. So thank you again for being here for our first WestU of the year, and we're looking forward to our next session in October. Good night and have a great evening. Thanks again, Dr. Pantel.
Thank you.